Hi everyone. Having discussed the happy mnemonic of the DNA viruses, we have one virus called the Hepatnaviridae which comes under DNA because it is hepatitis B, and all the other viral hepatitis that we have come under RNA viruses. So I've got this as a transition chapter between DNA and RNA. So we'll take up all the hepatitis. And also I had promised all of you in the pathology lectures that I will be teaching you hepatitis as a whole. So right in the end, I've got you a couple of pathology slides so that now you just have to read hepatitis over here, and this takes care of your entire path as well as micro in one lecture. So because I'm dealing with both subjects in the same lecture, I would say that hepatitis is many types. Number one, there is something called viral, which I'm going to focus on more. But what I've already taught you in pathology is the alcoholic hepatitis. Then we've also studied the non-alcoholic steatohepatitis. These have been covered. We have studied autoimmune hepatitis. Remember, emperipolis is very important, done. And finally, in neonates, it becomes neonatal hepatitis. So my concern over here will be viral, and we know primarily we are going to go from hepatitis A to E, and then I'll tell you hepatitis G also. So first, I think what I've already been telling you, that hepatitis B is the only one that is going to be Hepatnaviridae, matlab DNA virus. Rest all of them come under RNA. This much information you know. Now you need to know their families, and to learn their families you need a mnemonic out here, because I've realized that many students don't know the family member ka name, the main family origin. So hepatitis A, B, C, D, E you write in an order, and then you write the most accepted thing in our country, that private hospitals favor rich clients. Okay, so P is for picornaviridae. Now I will be teaching you picornaviridae in RNA viruses. It is also known as it has enterovirus, and there are many enterovirus, 70, 71, 72. So I'm talking about enterovirus 72 as hepatitis A. So P for picornaviridae. Next one, H for Hepatnaviridae, you already know because this is the only DNA virus that you have. Then F is going to be for hepatitis C, that is Flaviviridae. F is going to be for Flaviviridae. See, hepatitis D as such is not an independent virus. It is something that is always dependent on hepatitis B. So with R, I have learned it relies on hepatitis B, right? And finally, the last one with C, that hepatitis E is going to be Calciviridae. Also, now it is said to be a part of the family Hepiviridae. Okay, so that is another update that you should be knowing. It's now said to be a part of the family Hepiviridae. Okay, so I've told you private hospitals favor rich client, picornaviridae, Hepatnaviridae, Flaviviridae relying on hepatitis B, Calciviridae or Hepiviridae. Now let's talk about the mode of infection. I think the most well accepted point is that the first and the last, that is hepatitis A and E, are the only ones that have feco-oral route by which it comes. So I'll pick up these together in one group. Whereas all the others, especially B and C, are related to the parenteral, sexual and mother to child. So especially B is the one that is related to parenteral, sexual and mother to child. Hepatitis C is primarily related to parenteral. It could be that is related to blood transfusion, IV drug abusers. So parenteral se relation we have with hepatitis C. Right in the end, I know all of you are waiting for those things, which is the most common leading to chronicity, carrier, acute, and I've got a final flowchart right at the end where I've summarized everything. So no point confusing you with those sentences in between. End we'll make a chart and sort it out. Okay, now talking about their incubation period. So simple. The ones that are going to have a feco-oral route, that is hepatitis A and E, will have somewhat a similar incubation period of 15 to 50 days. Easy to learn. The feco-oral route wala, gastroenteritis wala, 15 to 50 days. The other ones that you have in between are again some similarity you will have to find. So hepatitis B and hepatitis D, because they are usually very much dependent. So 50 to 150 days roughly. And then thoda sa kam kara, so 15 to 150 days for hepatitis C. You might get a variation in many books. I've tried to make, rounded off numbers so that you can learn it in a more easy manner. Kuch books mein 45 days hoga ya kuch, but that becomes difficult to learn. Na? So simple to learn is the ones with gastroenteritis are 15 to 50 days. And uske andar, if you make it a little more, the hepatitis C becomes 15 to 150 days, whereas 50 to 150, 50 to 150 are hepatitis B and D, which are dependent on each other. Okay. Now, let me start off one by one. Before that, let me just give you a brief table about which are enveloped and non-enveloped. I think I told you all of the viruses are going to be enveloped, but do you remember the gastroenteritis ones are not enveloped? So basically, the ones that don't have an envelope are A and E. Remember a mnemonic called PARCH? Yes, which are the non-enveloped viruses. Non-enveloped may we had PARCH, and A and hepatitis A and E were not having an envelope. Okay, which out of these is cultivable? Only and only hepatitis A is cultivable. Only and only hepatitis A is cultivable. For which of these do you have a vaccine? Almost for all, and I'll tell you how. A and E ka to gastroenteritis wala vaccine is available. Hepatitis B ka vaccine is there, and since D is dependent on hepatitis B, so if B ka vaccine is given, the protection for hepatitis D is also sorted. Basically, I say that hepatitis C does not have a vaccine. And why does it not have a vaccine? Why couldn't I make a vaccine for it till now? I will tell you shortly. But broadly, you say everyone has a vaccine, including D also, because if you give vaccine for B, D ka coverage ho jayega. But C has no vaccine. Now let's talk about which of them is fulminant. So remember, D and E ka fulminancy is very, very important. Others, if you want to learn or don't, you can see the ratio is 0.11%. So I would prefer not to learn only. I will say that in dono ko yaad rakho. So what can you see? Which is the most common cause of fulminant hepatitis? The most common cause of fulminant hepatitis is hepatitis D, because I see the percentage right in front of me. However, if they change the question to the most common cause of fulminant hepatitis in pregnant ladies, and that is gonna be hepatitis E. Pregnancy mein 20% is written. If I actually tell you what, something which is not there in textbooks, but journals mein aa chuka hai, 25% is actually the fulminancy thing that you have to know. So reach out for the question. Most common cause of fulminant hepatitis, hepatitis D. But the most common cause of fulminant hepatitis in pregnant women, that is going to be hepatitis E. Now talking about the chronicity. Which are the ones which are going to go into chronicity? Hepatitis B and C are known to go into chronicity, which is common and potential. That I'll tell you in a while. Talking about carrier state. Again, for carrier state, I think we all know that hepatitis B is the most common to go into carrier state, and definition and all I'll tell you. So, overall I realized ones without an envelope are gastroenteritis wala. The only cultivable one is hepatitis A. The only one which does not have a vaccine is hepatitis C. Most common cause of fulminant is hepatitis D. Most common cause of fulminant in pregnancy is hepatitis E. The chronicity ones are B and C, and the carrier one is going to be hepatitis B. So gradually we will come on to this. Before I start off with all of them in detail, do you know there is something called hepatitis G also, which is not known to cause too much of a human infection, but whenever it enters into it doesn't cause infection, doesn't mean it cannot come in my body. It can come in my body, and it tends to affect the mononuclear cells. Single wala, like macrophages, lymphocytes, mononuclear cells. How does it come into the body? The route of transmission is going to be by blood transfusion. But they said that, okay, hepatitis as such, it might not be causing. But now there are studies which are saying that if hepatitis G comes into the body, it gives an inverse protection against HIV. So that is another study that is being performed. But a lot of more studies need to be done on hepatitis G. I just wanted to touch upon the topic because you will see this written as 1 or 2 lines. So it is going to affect the mononuclear cells, comes in via the blood, and can give protection against HIV. Let's move forward. Abhi, before going again, basics, sabka size yaad kar lo. So A, B, C keep on increasing. How I have learnt is that out of these, hepatitis A and E were the ones which were the gastroenteritis wala, na, so roughly same size, almost same size, 27 and 30 nanometers. Okay, so easy to learn. The ones which are associated with gastroenteritis are 27 and 30 nanometers. Then keep increasing. Hepatitis B is 42 nanometers and is also known as the Dane particle. The hepatitis B, which is 42 nanometers, is going to be the Dane particle. Hepatitis C, thoda aur bada, that is going to be 60 nanometers. So easy. A and E are going to be 27 and 30 respectively. B is 42 and C is going to be 60. Now we are finally ready to take on the world with the first hepatitis that we have, that is hepatitis A, which has an incubation period of what? Why should I learn like this? I will learn the incubation period like I had learned it for A and E. It was 15 to 50 days. That is why I've made it easier so that you can learn it that way. Fine. How many serotypes does it have? Hepatitis A has one serotype. There are 6 genotypes, out of which please remember that 1, 2 and 3 are the genotypes which are more commonly seen in humans. Out of which please remember, the first one is more commonly seen in the world and the third genotype is more commonly seen in India. These are all genotype. Dekho, serotype to ek hi hai, so whether it is in the world or India, it has to be just one. The concern is with genotypes. There are 6 genotypes. The first 3 are what is infective to humans. The first one is present all over the world and the third one is going to be common in India. Now, hepatitis A is susceptible to what? So, you can kill it by what all? You can kill it by boiling. You can kill it by chlorination, right? Chlorine can kill it. Autoclave can also kill it. And even formalin can kill it. So it's pretty susceptible to a lot of things. I can say it is heat susceptible because autoclave is killing it, boiling is also killing it, formalin and chlorine. These are the things used in a hospital. Now hospital mein kya karte? Ya to heat mein you do autoclave and boiling, chemicals mein you use chlorine and formalin. Hepatitis A is susceptible to all. And if it is a hepatitis, of course there is fever, anorexia, nausea, vomiting with jaundice. And we know jaundice matlab, how is the patient gonna come up to you? Dark urine and pale stools. There is nothing new that I'm telling you. This is all gastroenteritis wala features. Fever, anorexia, nausea, vomiting because fecal-oral route hai, nausea, vomiting hoga. And jaundice of course because it's affecting the liver. Okay, now moving forward, we know you are waiting for the lab diagnosis. So for the laboratory diagnosis, this is one of the easiest graphs that you have. You just have to look at 2-3 things. So the first thing to rise, can you see? The first thing to rise is the HAV, hepatitis A virus shedding. So remember that I can see symptoms over here. What symptoms? Symptom obviously ma'am jaundice hoga. So in the stools 2 weeks prior to 2 weeks after the jaundice, we are going to see hepatitis A virus in the stool. So please remember, if this is the jaundice that they have shown you, so 2 weeks before the onset of jaundice to 2 weeks after the onset of jaundice, you are going to see hepatitis A virus shedding in the stool. So fecal HAV is important. Okay, HAV dekhiye na, you have to see the antibodies IgM and IgG. As soon as the jaundice will start, you can see with the starting of jaundice, can you see that there is an increase in your IgM antibody, right? Everyone can notice as soon as the jaundice will start, there is going to be an increase in the IgM antibodies. And 2 to 4 weeks later, compare karo, where is IgG gonna start off? So approximately you will see 2 to 4 weeks later IgG is seen. So the levels start definitely rising, but thoda sa 2 weeks ka gap hota hai because IgM is primary immune response and IgG is gonna come up later. So simple. The primary question that comes is HAV is related. 2 weeks before the jaundice, 2 weeks after the jaundice. As soon as the jaundice will start, the antibody response is gonna be seen. Since I told you I will be correlating this with pathology, do you do a liver biopsy? No. These are acute hepatitis. Acute hepatitis ke liye liver biopsy not at all indicated. In fact, for hepatitis only, hepatitis is an infection. Why for an infection will I have a liver biopsy? Liver biopsy will be done for bigger things like cancers. So nahi karte. But still if they ask you that on a liver biopsy, the acute hepatitis, the 2 acute hepatitis, that is hepatitis A and C, which are going to spread by the fecal-oral route, if I ask you what are they going to be showing you on a liver biopsy, so remember, hepatitis A shows you an increase in the plasma cells and hepatitis E shows you cholestasis. Cholestasis means the bile is going to be static or slow. Bile plugs are seen. Again, no one will give you a picture, no one even does it, but theory, MCQ questions. Hepatitis A shows you plasma cells, hepatitis E shows you bile plugs, that is your patho integration. Finally, coming back to micro and medicine, is there a vaccine? Yes, there is a vaccine available and that vaccine is a formaldehyde inactivated vaccine given as an intramuscular dose. So please remember there have to be 2 doses that are given, which are roughly 6 to 12 months apart, and it is given to people who are aged above 12 months. So 12 months ka age gap ka duration between the 2 doses. So dose 1 and dose 2 with a gap of 6 to 12 months and the age is equal to above 12 months. That is when it is given. There is also another vaccine that is taken up in some countries which includes the live attenuated vaccine. This is made up of multiple strains like OH and OLA strain. Again, there are different vaccines being prepared which you have to know. But whom do you give immunoglobulins to? This is there for hepatitis A as well as hepatitis B. Immunoglobulin will always be given to someone who is not vaccinated and has undergone some kind of an exposure. So please remember that who has undergone some kind of an exposure and is unvaccinated, and especially, for example, someone in the house has hepatitis A and then someone is living with him and that person is unvaccinated. So to all the unvaccinated contacts, it has to be given within 2 weeks of exposure, and the protection will last for roughly 1 to 2 months. So remember, even if someone comes with hepatitis A, all the contacts who are unvaccinated, they have to be given immunoglobulins. Are we sorted with this? Hepatitis A ho gaya. On that note, I will quickly wanna also finish off, guys, hepatitis E. Why would I wanna finish it off? Because that is the one that is another feco-oral wala. So please note, in hepatitis E, everything I have told you. Which family belongs to RNA viruses? What is the family that you have? Earlier it was calciviridae, now it is hepiviridae. Feco-oral route, acute hepatitis hai, 15 to 50 days ka incubation period. It is the one A and E, they are non-enveloped. Can it be cultivable? No, the only cultivable one was A. Baki sab mein no. Is there a vaccine? Yes, there is a vaccine, although I would say that it's only in China. I'll talk to you about it. Is it a cause of fulminancy in pregnant women? Yes, it is. So please let me know now that when I'm talking about hepatitis E, what are the quick points that I can tell you? It is now belonging to the Hepiviridae family, which belongs to the RNA family members. Let me tell you, in terms of the route, it is going to be a feco-oral route, and it is of course going to cause acute hepatitis, right? But in pregnant females, in pregnancy, the fulminant hepatitis rate is going to be a 25%. It causes fulminant hepatitis. Okay, what is the treatment? Like I told you, supportive treatment hoga. However, is there a vaccine available? Again, there is a vaccine available, but that vaccine is available in China, and that is a recombinant capsid vaccine. So for China, there is a recombinant capsid vaccine that is available. Capsid protein ka vaccine hota hai, that is available. Just some points about hepatitis E. I don't think anything new I told you. Everything I had already told you in that table. So table ko agar short note banao, to it is ready. The only thing I can tell you extra is there is a vaccine in China which is available. A and E are done. I'm going on to next, the chronic hepatitis. I'm starting with the most deadly and the